Welcome to Medical Insight, a weekly healthcare feature brought to you by the experts at Essentia Health. Here's your host, Maureen Tallarico.
Today on Medical Insight, we talk with pulmonary and critical care physician Dr. Eric Swanson about lung cancer.
Lung cancer is the #1 cause of cancer-related death in the United States. For both men and women, there are over 100,000 new cancers diagnosed every year in both men and women, and it ranks behind breast cancer and prostate cancer as far as new diagnoses of cancer in the United States. So lung cancer is like any cancer, it's cells that go awry, developed initially in the lung tissue and grows typically in the lung tissue first, and then can spread to the lymph nodes and many other locations.
Dr. Swanson explains who is at risk for developing lung cancer.
Lung cancer can affect anyone of any age. However, the primary population that's at risk is those individuals between 55 and 77 with a positive smoking history.
Having a positive smoking history means you have smoked a pack a day for 30 years, 2 packs a day for 15 years, or the equivalent. The more you smoke and the longer you smoke, the higher your risk for lung cancer.
First thing to do is talk with your primary care provider regarding your risk of lung cancer and if you're eligible for screening. After they've determined if you're eligible, then you end up getting a low-dose CT scan, at least on a yearly basis. If your lung cancer screening CT is abnormal, typically what ends up happening is you then get referred to the pulmonary clinic where we talk about the CT scan, what we see on it, whether or not we should follow this up with short-term follow-up CT versus doing some sort of a biopsy to diagnose what's actually going on in the lung.
For Medical Insight, I'm Maureen Tallarico.
To learn more about this topic, call our experts at 786-3107.